Welcome to week number 4. Again, I'm Dr. Julie Aiken, and I'm excited to discuss stage 2 labor with you, which is birth of the baby, stage 3, the placenta, and stage 4, postpartum. So with that, let's move to the very first slide. Stage 2 labor, or the pushing stage. This extends from the time the cervix is fully dilated to the birth of the baby. This can be anywhere from 15 minutes to 3 hours. The uterine contractions during this stage of labor are usually a little bit farther apart than they were in transition. The frequency is about every 3 to 5 minutes, and the duration of these contractions is about 60 to 90 seconds. So on the following slide, we're going to discuss the difference between spontaneous pushing and deliberate pushing. So without an epidural, or the anesthesia that makes you fairly numb, many women will find that urge to bear down or push, they'll find that pretty much irresistible. For most women, the sensations of pushing are much less painful than the contractions that they just experienced in transition. So it actually feels good to be able to start pushing, and the body's natural endorphins provide some pain relief during this pushing stage. Most women describe pushing as a tremendous relief from the more difficult transition phase. So with the term spontaneous pushing, this describes how a woman pushes when she's laboring without an epidural. She'll feel a very strong urge. In fact, it's difficult to tell a woman not to push. It's almost impossible for them. So as the uterine contraction begins, you'll feel the need to bear down. We have the woman take a deep breath and push, counting to about 10. You may make grunting sounds. We hear that quite often with women that are pushing. And when you feel the need for more air, we have you take another deep breath and push again. So you'll get approximately 3 to 4 good strong pushes in during each contraction. And that's called spontaneous pushing. Now, the other term is called deliberate pushing, and these are for women who have had an epidural. Even though you have an epidural, you will still most likely feel that urge to bear down. And women describe this feeling as very similar to the feeling when you need to have a bowel movement. So I always tell women, even with an epidural, let me know if something feels different. You'll feel pressure, and it will feel like you need to have a bowel movement. And I would say 9 times out of 10, women recognize that, even with that epidural. This phase, you really need the help of a support person, because if you do have an epidural, your legs are heavy, you're not able to move them as well, and you'll need the help of your healthcare team and your support person to help direct you to push, that your pushing will coincide with the uterine contractions. So the fetal monitor that you'll have on will show the beginning of each contraction, at which time we'll have you take a big, deep cleansing breath in and out, and then you'll take a second deep breath and you'll bear down or push with your abdominal muscles in correlation with that uterine contraction. So you may be directed to count to 10, let the air out, take another deep breath, and bear down again as you count to 10. You'll typically get about 3 good long pushes with each contraction. When the contraction's over, we have you take a deep cleansing breath and then rest until the next contraction begins. And again, your healthcare provider will be helping, watching the monitor, so we'll know when those contractions are beginning. And this is a great time for your support person to be there to help encourage you with words like, "Good work," or "The baby's almost here." So on the following slide, we're going to discuss the positions for pushing, and you can see some photos here. Semi-sitting is the most common, and that's the position that you've seen in all of our pictures so far. And you'll be kind of in a semi-sitting position in the bed, particularly if you've had an epidural. Your legs may or may not be in stirrups, and you'll have a little bit of an incline, at least, not 90 degrees, but maybe 45 degrees. This is a typical position for labor when you've had an epidural. Squatting, you'll see in that top picture a woman using what we call a squat bar that we can actually put on the bed. This can really help to widen the pelvic outlet. And if you've not had an epidural, truly squatting is probably the easiest position to birth a baby. It can be a little bit more difficult for the healthcare team, but if you're having difficulty with the size of the baby's head coming through that pelvic outlet, squatting is the position we would hope to put you in. Side lying is another position where you can push, and this may ease back labor. We talked about the baby that might be in a posterior position. Side lying will ease that, and it also might help slow the descent of the baby if the baby's moving down too quickly and you're unmedicated and we're waiting for a doctor, things like that. Hands and knees, this may help rotate that baby from a posterior position to an anterior position. And as you can see in that third picture, this would also help decrease that pressure on the lower back if the baby's in a posterior position. So the following slide, we'll talk a little bit about episiotomy and repair. So an episiotomy is a deliberate incision that's made between the vaginal opening and the anus. An episiotomy will enlarge the vaginal opening and it will help facilitate the birth of that baby's head. Know that you'll be given a local anesthetic that will numb that area so that when we repair or sew up those tissues, it won't be painful. But I will tell you, most women report some degree of pain after that anesthetic wears off. So the episiotomy is something that you will definitely recognize when the anesthesia wears off, and we'll make sure that we have pain medications. We also like to put ice on the episiotomy, or any woman that's delivered, even without an episiotomy. There's a lot of stretching and definitely inflammation that occurs after birth, and so we like to put ice on those perineal tissues to help decrease that swelling. Again, recognize if you are asked to stop pushing during a contraction. We talked about this a little bit earlier, but you may be asked to pant, or we call them pant blow breaths, and it's just like it sounds, panting. And you're doing that until the contraction ceases. So as you pant, if you're asked to do that, focus on relaxing those perineal tissues or muscles. So on the following slide, wanted to show you a picture of a birthing table. So these are simply the sterile birthing instruments that can be used. And once we know birth is imminent, that you're starting to push, the healthcare team will set up this birthing table with sterile instruments. And the important thing to know is that they are sterile, so you don't want to be touching them or picking things up. We want to make sure that every instrument, if we use that it is sterilized and we decrease the risk of any sort of infection. So the following slide, we're going to talk about the birth of the baby. Once the baby is born, your healthcare team will dry the baby off and stimulate the baby to cry. This is really important. That stimulation and drying off helps that baby to cry, and that facilitates breathing and normal circulation, which leads to a normal transition to life outside the womb. So if it's desired, something you're interested in, we can place the baby directly on the mother's skin. We call that skin to skin. And we can even place the baby to your breast if you're planning on breastfeeding. So skin-to-skin contact after birth facilitates infant bonding, and it also is really important because it helps serve to keep your baby warm. And recognize your baby's been inside that womb. It hasn't had to thermoregulate its own temperature, and now it's outside in the air. It's wet. And you know how you feel when you get out of a warm bath. You want to dry off quickly. So it's important to dry that baby quickly, and we like to place them skin to skin if that's an interest that you have. On the next slide, we're going to talk stage 3. You've seen this picture before. It's the placenta. So in third stage labor, the baby's been born, and now we're going to have the delivery of the placenta, or as it detaches from the wall of the uterus. 5 to 20 minutes, it will detach all by itself, and you might feel a mild contraction during this stage. Your healthcare provider may even direct you to push a little bit as that placenta is expelled, but you'll feel an incredible amount of relief once that placenta is delivered. Your healthcare provider will examine that placenta to ensure that it was delivered intact, meaning we wouldn't want any portion of that placenta to have remained inside the uterus. That will cause bleeding later, potentially even a postpartum hemorrhage. So we always check that placenta, make sure that it's intact and the whole placenta was delivered. And then we look at the umbilical cord. We'll examine that to ensure that there are 3 vessels. There are always, or should be, 2 arteries and 1 vein. Know that once that placenta is delivered, you're holding your baby, you will be experiencing great joy at this point as you get to see your baby. There's a relief from the discomfort of the contractions, and this is a really joyful time inside the birthing room. Stage 4, again, postpartum. This is the first couple of hours or first 4 hours after your baby's birth, and we call that the 4th stage or postpartum. Your body is rapidly adjusting to its new non-pregnant state, and know that once that placenta has separated from the wall of the uterus must continue to contract to prevent excessive bleeding. So your uterus will feel like a firm grapefruit-sized mass, and it should be right at about the level of your navel. The nurse or whomever the attendants are will be massaging that uterus frequently to promote contractions. This may feel somewhat annoying, but it's really important. This will help to ensure that you do not bleed out excessively or have a postpartum hemorrhage. The nurse will also be assessing the amount of vaginal blood flow. It's called lochia, and she'll be looking, or he will be looking at that frequently. We'll be monitoring your pulse and your blood pressure very closely for about 1 to 2 hours after birth. Expect that we'll probably have placed an ice pack on the perineum for swelling. And if your baby's transitioning well, meaning it's pink and breathing well, it's not having too much fluid in its breathing passages, if your baby's doing well, you'll have the opportunity to touch and hold your baby. Most newborns are quite alert and awake for about 1 to 2 hours after birth. So initiating breastfeeding here is a perfect time because your baby is alert and awake. And also, breastfeeding increases that oxytocin, which will help your uterus contract. So it's a perfect time for infant and parent bonding, for initiating breastfeeding if that's your interest, and make sure that if you've not breastfed before, that you ask for some help. If you need assistance with latching on and getting the baby's mouth to breast, we're there. The healthcare team's ready to help and assist you. So following an uncomplicated vaginal birth, most women can return home about 48 hours after delivery. A cesarean section birth requires 3 to 4 days in the hospital before returning home. So make sure during this postpartum time, when you've got some help, that you are learning how to care for your infant and that you're also getting adequate rest before you return to your very new routine at home with your new baby.